all. I am Mrs. Deepika Sri from the Department of Physician Assistant and Life Health Sciences. Today we are going to explain about the condition of diarrhea. Now we are going to say about the pediatric diarrhea. So pediatric diarrhea, diarrhea is a Greek word meaning flowing throughout its second leading of the dead children 5 years of year. So definition, according to WHO, World Health Organizations, diarrhea is defined as passage of 3 or more stool per day or passing more stool than normal for the age. So this is defined as diarrhea. The incidents are every year there are about 1.5 to 2 billion deaths of diarrheal disease occurs. Diarrhea is second leading cause of child mortality and morbidity in the world. 1 in the 5 children die of diarrhea every year in India. It mostly due to contaminated food and water sources. So mainly for contaminated food and waters induce diarrhea for the children. So we should avoid the outside foods. We should cleanly make from our home itself. So homemade foods are always safe to the pediatrics. So classifications. There are two type of classification based on duration. The first one is acute diarrhea, another one is chronic diarrhea. Acute means short term, chronic means long term. And the etiology. The etiology is the causes of diarrhea are infection, drugs, dietary causes, surgical conditions and miscellaneous causes. So these are all the causes of diarrhea. The physiological disturbance in diarrhea is diarrhea leads to loss of normal alkaline secretion and fluids, and it also leads metabolic acidosis, and it also leads dehydrations. So which leads to it leads to inflammation and edema of mucosal membrane, which can lead to released organic acids, which leads to increased bacterial growth, and also which may lead to chronic diarrhea and fluid loss and carbohydrate increases. So this all can make increased bacterial infection, which cause multiple episodes of passing stools. So these are all the physiological disturbance in diarrhea. Another one is clinical features: mild diarrhea, moderate diarrhea, severe diarrhea. Mild diarrhea means 2 to 5 loose stools. Moderate diarrhea means 10 or more than that. That means moderate diarrhea. For severe diarrhea, 100 times within 24 hours. 100 times, that means not exactly like that. On and off the patients is passing stool. That means, for example, for saying it's mentioned as 100 times, not exactly. Maybe some patients can't do 100 times. It means which passing the continuous stool. So that is severe diarrhea. Diarrhea evaluation: history taking, physical examination, stool examination, stool culture and blood test. So these are all the physical examinations. The diagnosis means history taking means whether we give outside food or that food history, and also drug history. If any drug induced the adverse effects of this diarrhea, so drug history. And physical examinations, whether the abdomen is distended, so that can and the patients look dehydrated. So these are all the things we are going to look on the physical examination. And stool examinations: collect the loose stools and we can send it to lab. In that we can get the result whether it is infections or some other causes. Another one is culture of the stools: what bacteria is growing in. So that antibiotic or antimicrobial drugs we can give accordingly. And also blood test. And management of diarrhea. The management of infants and young children is of diarrhea and dehydration focus on replacement of fluids, because the patients get more dehydrated. So replacement of food is replacement of electrolytes is very important in diarrhea for either the patient may be young or older. Another one is administration of prescribed drugs. That means anti-diarrheal drugs. For example, ciprofloxacin, doxycycline. So these are the anti-diarrheal drugs. Another one is maintain of nutritional status and educate the mother regarding prevention of diarrhea hereafter. So these are all the 4 important management for diarrhea. There is no any other surgical or emergency, but we can ORS, oral rehydration solution. It is very much important for diarrhea. Thank you.